Welcome to The Birth Breakdown, a minisode series from Her Birth, Her Story. These short episodes are here to open conversations around pregnancy, birth, and postpartum. Things I believe that every woman deserves to look into, to question, and just to feel empowered by. This isn't about telling you what to do, what's right, or what's wrong. It's about giving you space to think, to learn, and to ask questions, to just trust yourself a little bit more as you prepare for your birth. So let's break it down. In today's episode, we are going to be comparing the three birth settings: hospital, birth center, and home birth. No fear-based opinions, no romanticizing, just the facts from both a medical and holistic standpoint, so you can make the best decision for you. So first, we're going to start with the hospital birth. So from a medical standpoint, hospitals are designed for risk management and emergency response. You have immediate access to OBs, operating rooms for C-sections, epidurals and anesthesia, continuous fetal monitoring, NICU care if needed. So hospitals are normally more seeked out in high-risk pregnancies, preterm birth. If you are having multiples, even though sometimes people choose to birth twins at home, or medical complications, from a strictly medical lens, hospitals provide the highest level of intervention capability. So from a holistic standpoint, hospitals can feel very clinical, very policy driven. Some hospitals are actually very supportive of physiological birth. They give you freedom of movement, intermittent monitoring. Some places offer labor tubs, which is really nice. Sometimes they support delayed cord clamping. Some other hospitals might have higher intervention rates, policies and protocols that they stay strict to. And they might even place time limits on labor. So some pros to a hospital birth is that there is emergency care immediately available if needed. There are a lot more pain management options, especially when it comes more on the anesthesia side. It gives you kind of a strong safety net for if complications were to come about. Some cons or things that kind of turn people away from the hospital is that there are higher intervention rates in some hospitals, which a lot of times might mean that just getting into their care might mean that you get a lot of interventions that you did not actually need. There's a possible lack of continuity because whoever's on call is going to deliver your baby, and that could be somebody that you don't want to deliver your baby, and that can be really stressful. It is very medical looking. So it's very less home-like. So if you are already a person who is terrified of the hospital or gets anxiety going into the hospital, just know that it's still very much similar to that. It still looks medical. It definitely does not look like your home. So then that brings us to the birth center. A lot of people say that a birth center is like the happy medium between a hospital birth and a home birth. So the birth centers that I'm talking about are the freestanding birth centers, not a hospital-based birth center, because those birth centers a lot of times still feel like a hospital. Medical standpoint, birth centers are for low-risk pregnancies only. They are typically staffed by certified nurse midwives, and they can actually carry emergency medications like oxygen, Pitocin for hemorrhaging. However, they do not offer epidurals or have any surgical capability. They will transfer you to a hospital if complications arise. Transfer rates vary, but are most common for first-time moms, long laborers, if the mom is desiring for some pain relief. For low-risk women, research shows that outcomes are comparable to hospital birth, just with lower intervention rates. And this is very important to remember too, that obviously we are talking about the standalone birth centers. So basically you would just be going to another place to birth your baby that is kind of set up more like a home. You just have some access to a couple of more interventions that may help you, but it still can result in a transfer. The birthing centers that are hooked to a hospital, obviously, you are going to have more emergent care available if needed. From a holistic standpoint, birth centers are designed around physiological birth, and you'll typically find large tubs, whether it's a bathtub or birthing pool. You'll have freedom to eat and move around with minimal monitoring. It's just very calm and it's more home-like than a hospital. Your prenatal visits end up being longer normally, and the care often emphasizes nutrition, emotional preparation, education, autonomy. So some things that stick out that would probably be pros in this area going with a birth center is that they have a lower C-section rate for low-risk moms. It's a lot more of personalized care. It's more of a comfortable setting and it's non-clinical, so you don't feel like you're just walking into a hospital having a baby. Some cons of a birthing center is you still don't have an epidural option and you could still be transferred to the hospital for emergencies. So this is not appropriate for high-risk pregnancies. So a birth center would be great for you if you're not really wanting to do it in your home, but you're wanting an unmedicated birth with just like a bed and a birth tub that feels more homey and relaxing and does not feel like you're just trying to give birth in a hospital. So now we're going to jump into home birth, and from a medical standpoint, planned home birth is intended for carefully screened low-risk pregnancies with a trained midwife. And if you listened to the episode that I did interviewing a midwife, she goes in to talk about how important it is to vet your midwife because every state is different in what they require midwives to have, what certifications, training, and stuff. So you want to make sure that you vet because not all midwives are created the same. So midwives can actually bring emergency medications, oxygen, they have the neonatal resuscitation equipment, but there is no immediate surgical access, no epidural, and emergency transfer to the hospital if complications do arise. So for low-risk pregnancies, especially with skilled providers and the appropriate screening, outcomes can definitely be comparable, but distance from the hospital definitely matters. So a lot of times your midwives are going to make sure where your nearest hospital is and if they can handle an emergency if one were to happen for you or your baby. Home birth is not recommended for very high-risk pregnancies. Breech in most cases and twins in most cases. You can still have both of those at home because I have actually seen many people do it. It's just making sure that you are with somebody that can help you through both of those. You don't just want any midwife. You want to make sure your midwife can help you with a breech birth or with twins. If you have significant medical complications, home birth probably isn't the best place for you. So from a holistic standpoint, home birth is centered entirely around autonomy, your familiar environment, undisturbed physiological labor, minimal intervention. You get to control the lighting, the noise, who is present, how you move, where you move, what you eat, and your birth positions. Many women report feeling way more relaxed in their own environment, which can support natural oxytocin flow, which is crucial for an unmedicated birth. Some really awesome things about home birth is that it actually has the lowest intervention rates, total control of your environment. The continuity of care is amazing, and often everything from prenatal even to postpartum support is very personalized. There's no blanket statements. It's all about you, your baby, your specific health, and they are there to support you from prenatal all the way to postpartum. Some things that may make you question whether you want a home birth or not is that there is no immediate surgical backup. It does require an emergency transfer to the hospital if an emergency were to pop up, especially if it's something outside of the midwife's scope of practice. So instead of asking, which is safest? A better question might be, am I low risk or am I high risk? Because in the birth world, a lot of people always ask, especially with home birth, is that safe? If you are a low risk mom, it is safer. And sometimes it ends up being safer than the hospital because a lot of times midwives allow you in your body and your intuition to just move through labor exactly how it's supposed to without the constant interventions, interruptions, and you just feel a lot safer in the comfort of your own home. Another question might be, how comfortable am I with medical intervention? Like I had said earlier, if you're somebody who has anxiety in hospitals, it might not be the best for you to go there because you are probably going to get a cascade of interventions because you're already fearful, anxious, even stepping into a hospital. How important is immediate access to surgery? Are you somebody that feels safer knowing that they can perform an emergency C-section right then and there if you need one? Or is that not a fear of yours? How important is staying in my own space? Because like I said earlier, if you are anxious to go to the hospital, you might feel a lot safer being in a familiar place, whether it's your living room, your bedroom, birthing in the pool, and that is very crucial. What helps me feel safest? Technology or a familiar place? Safety isn't just physical, it's emotional too. But medical risk level does matter as well. The bottom line is hospital birth prioritizes immediate medical access with immediate interventions as needed. A birth center prioritizes low intervention care but with nearby backup. And home birth prioritizes the true physiological birth in a familiar setting with transfer plans in place. There isn't a universally right choice because guess what? Birth is not a one size fits all. There is only one choice that aligns with you and your health and your body and your risk level, your comfort level, your support system. And it's important that you pick where you feel safest, where your provider supports you the best, because wherever you feel safest, wherever you feel encouraged, wherever you feel empowered and educated, you are going to have a better outcome because of these things. If this episode sparked curiosity, affirmed something you've been feeling, or just gave you a whole new perspective, I'd love for you to share it with another mom or mom-to-be who might need it. Make sure you're following Her Birth, Her Story, and if you feel called, leaving a review is one of the best ways to support this space. And it just helps these conversations to reach more women. Until next time, remember this is your body, your baby, and your birth. We are reclaiming birth one story at a time.